All right. Good morning, Chair Postman, members Garrett and Bollendroff, staff and guests. The lobbies are open and the recording has begun.
Morning, Dustin. Thank you. We will convene the Liquor and Cannabis Board Caucus meeting for February 7th, 2023. Good morning, everybody. We're going to start today with a legislative update because Mark Webster needs to get back to the legislative session. And so appreciate you jumping on for. We'll turn to you first. How's it going?
It's going well, and good morning, Chair Postman and members Garrett and Bollendroff. Our social equity bill, as we talked about last week, is in a good state in the Senate, and thus I was pretty happy to see that it's been dropped in the House, aligning with the substitute version in the Senate. So I think in general, I think there's some skepticism when our agency request bills come out in a different form. But I think in this case, I certainly understand and support the idea of kind of skipping ahead to a version that's already been vetted a bit and is in a form that many stakeholders in the LCB, of course, can support. So we're very happy to see that bill drop from Representative Entenman. That process of stakeholder work and looking at amendment language is now underway on the THC bill of ours, Senate Bill 5367 in the Senate. And the House version, which also took a little while to be introduced and heard, will have a hearing today, this afternoon, in the House Regulated Substances and Gaming Committee. We've supplied a technical amendment on the Senate side after hearing from insiders like testing labs and even a chemist from another state agency that our definitions may not have been broad enough to regulate some of the new THC variants that have popped up. And so I think that's now included in the next version of 5367 that we'll likely see later on this week. There's some other amendments, amendment language floating around delineating hemp consumables and hemp and food from the kind of hemp-derived products that we're trying to regulate. And of course, this is all going on while the Federal Food and Drug Administration kind of threw its hands up and asked Congress for more guidance around regulating hemp products like CBD and CBD in food. I think there's still a lot of work from stakeholders who want to see changes to the THC threshold in the bill, which is 1 milligram per serving and 3 per package. Under that, it wouldn't be regulated by the LCB. Above that, it would be. But that hasn't changed as of yet. I think there's a lot of folks in the hemp industry who want those thresholds moved up. And of course, many in the 502 market who would like those numbers to move down. Senator Saldana's adult entertainment bill, that among other provisions around dancer safety, would direct the board to allow alcohol to be served in adult entertainment nightclubs, was heard yesterday in the Senate. And then the bill's proposing to extend the House Bill 1480 temporary privileges, allowing alcohol delivery from restaurants, continue to attract debate and work. Representative Reeves convened stakeholders and the LCB, like Justin Nordhorn, to figure out what it would look like under a scenario in which the bill's passed. She completely understands that the board is opposed and that the governor's office is strongly opposed, but appreciates kind of the working through the technical side with some of the stakeholders there. Our subpoena authority bill has passed to Senate rules with an amendment that adds a comma. Hard to imagine a smaller change, so we are hoping that a bill that small and with no fiscal note will move quickly. And that's all I've got for today. More to come, certainly in the coming weeks.
Great. Questions for Mark?
No questions. And Mark, thank you. You've taken a lot of time, one-on-ones. So I really appreciate working with you this session.
I've enjoyed working with the board as well. Thank you, Ollie.
Mark, I just had one question / comment about the social equity bill, the new version that's out there. And you and I have talked about this a little bit, which is the line about who has the authority to increase licenses, either in the both in the social equity realm and in the existing market. Do I understand right that the current version gives only the legislature the authority to do an additional social equity licenses after this bill, but the agency has has administrative authority to do for non-social equity?
Certainly, I think the changes in the bill are targeted around social equity. I've got to be honest, I think there's still kind of an open question, and I defer to some of the lawyers on exactly where the authority resides, especially for the non-social equity or the broader program.
That's I would appreciate if we could dig into that a little bit. When I first looked at the language, it didn't jump out at me, but the more I've thought about it, so the question I have, regardless of what it says today, what I would like us to be aware of is to not endorse or set up a system where it's essentially easier to increase non-social equity licenses than it is social equity licenses. So if I'm a social equity applicant and I need to go to the legislature and lobby the legislature to increase the cap, that's a big chore. If it's a non-social equity and they just can come to the agency and ask for that, we're creating an uneven playing field, to use the hackneyed phrase. Does that make sense? So I just would appreciate sort of an eye on that. Ollie, do you have an idea of what's going on?
I thought that right now, all new licenses are supposed to be social equity license for so many years.
That's part of the question, though, is does this language mean that they're all that way? I just think we need to be really get some clarity on that question, because
I was under the assumption that all new license are social equity license for the next, I thought it was either 5 years or something like that.
Well, that's what I thought our bill said originally, something like that, but
right.
Anyhow, I'll have to look more carefully too, but I would just, folks that are smarter than me who could look at that as well, with that in mind, is what would that system look like? Because I don't see that specific prohibition on increasing other license types. It seems like it sets up two channels.
Yeah. Is somebody from license on or in the room?
I don't see, but I think we can get I'll ask somebody to answer that question for us, and we'll probably have to ask the lawyers too for the view of that. But yeah, I think, so, okay. All right. Any other questions for Mark? Okay. Thank you, Mark. We'll let you get back to it.
Thank you.
Appreciate that. Next, we've got some exciting news with a new member of our leadership team, and I'm going to call on Tony Hood, our Deputy Director, to introduce our new CFO.
Thank you, Chair Postman. Thank you, Member Garrett and Vollendroff. I'm excited to introduce Rachel Swanner, who's our new CFO. She comes to us from L&I, but she's also worked at GSHS and DCYS. And she is a cougar. She got her undergraduate at WSU, went on to get her MBA, and she told me just for fun, she got her CPA license recently. So it tells you a little bit about her personality since she did that. But she's only been here since the beginning of the month, but we're very excited. She's jumped in and met a lot of people, and I will let her say hello.
Right. Thank you so much. Thank you for giving me a chance. I'm really excited to be here. I heard amazing things about this agency, and it's a really good opportunity. Like Tony said, I'm already digging in and trying to get to know the people and the business. So I'm really excited for the future.
Great. Well, welcome. We're excited to have you. And when I heard that you initially told us that about that the CPA was just kind of a hobby for fun, that tells us kind of what we're looking for in a CFO.
Yeah, I love accounting. I'm an accounting nerd.
Yeah.
So even if you have questions outside of just the business here, I usually answer
them. Good, because I'll be bringing my taxes in. Thank you.
So
Thank you
guys.
And you'll get the chance at some point, but Ollie Garrett and Jim Vollendroff obviously on the screen there too, and hopefully you'll have a chance to talk and get to know each other. Next, we'll get an update on the cannabinoid science work group from Dr. Kathy Hoffman.
Thank you. Good morning, Chair Postman. Good morning, board members, Garrett and Vollendroff. Wanted to give you an update on what was going on with the cannabinoid science work group, and then hopefully have a bit of discussion on helping the work group sort of scope their pathway forward in terms of what we're asking them to look into. So just to give a brief background, our first meeting was on December 1st of 2022. And really the purpose of that meeting was to sort of set the foundation for the group, let them introduce themselves to one another, and then share a research interest related to cannabinoids with the rest of the group. And then we went through the charter to see if there were any questions or concerns, and then we moved forward. So in between the time that we met on December 1st and when we met last week on February 1st, we had taken all of their research interests and separated them into buckets because they very clearly went into 3 different research buckets. The first had to do with cannabinoids and their effect on the body. Second had to do with cannabinoids and DUI. And then the second had to do with the regulation of cannabinoids. And that was, I think, Dustin, I believe that we shared these documents with the board, correct? Okay. So for the second meeting that we had last week, using that sort of bucketing of their research interests, asked them to kind of take a look at where they might want to start doing their work based on what the purpose statement was in the work group charter. And the work group had, I would say there was some difficulty in self-selecting from those groups. They wanted to know more from us about the direction that they would like us to go, or the direction that they would like us to go, like them to go, pardon me, in the work of the cannabinoid science work group. The other thing that happened during the course of the meeting was trying to define the term cannabinoid. And I think it's fair to say that defining cannabinoid, at least to this group so far, is a very contextual exercise. You can define cannabinoid legally, you can use it as a marketing term, and then there's also scientific terms. So really broad range of responses there. So we didn't come away with a solid definition or even a working definition of cannabinoid. So I bring this to you today to offer a couple ways that we can go with this, and then reach out to you for any direction that you'd specifically like to take with this group. And the one thing that I was thinking of was starting with structure or function with cannabinoids. And I know this is something the agency has grappled with. Turn everybody's interest or back to our policy statement that we issued mid-2021. Trying to figure out how we apply structure or function as it is described in statute at this point on cannabis packaging and labeling. And that's medically compliant cannabinoid or cannabis, excuse me. So, and there's implications for how cannabinoids are described within that structure or function space. So I think this would be a really good place for the work group to start a dialogue, because it does have implications for how cannabinoids impact the body, so on and so forth. Go ahead.
Can you back up a tiny bit, just
Sure.
give us that structure, with the definition of structure and function. What are we talking about there?
Structure or function is not defined. That's the challenge.
But it meant something in our policy statement.
It did.
In layperson's terms, what
Yeah.
are we talking about?
It defines the medically compliant cannabis product structure or function claims to the extent possible, meaning that the statement is not meant to address a disease,
right,
or help with a diagnosis. It just says this, for example, this product will help with stomach upset.
Right.
I think that's the most basic example I can provide.
Right. So and that's the function, right? So what we're trying to get at there is to regulate what people claim these products can do.
Right.
That would be the function part of it, right? So they could
Exactly.
maybe say helps you relax, might be okay, but deals with diagnosed anxiety, you could not say.
You could
because
not
that's
say
a
that.
different, right? Okay.
Correct.
I just wanna
And,
make sure.
and we're the only state that allows even medically compliant product manufacturers to make a structure or function claim. And then on top of this, we've already seen that in Senator Schumer's bill, kind of kicking that over to the FDA, structure or function on the cannabis side. So we could be doing some of that pre-work that could help inform legalization efforts in the future. And it does cross over the disciplines that are represented on the cannabinoid science work group.
And that is what the FDA does today outside of this world.
Yes.
Right? That's the agency in the US that does those things. The state doesn't normally regulate that, right?
Right.
We do in this case because nobody else is.
That's right. With products that are termed nutraceuticals, that sort of thing.
Nutraceutical.
Nutraceuticals,
Okay.
yes.
Thank you.
Yes. So that was one suggestion I had, and I think that, you know, something that the cannabinoid science work group was looking at is what can we start working on as sort of a short-term concern, and what can we start working on that's more of a long-term concern. And I think the structure or function claims fits both of those questions. The other thing that they thought about in terms of short-term was taking a look at hemp-derived cannabinoids. I know that's been a topic of discussion for many of us for a while. And then, let's see, harmonizing testing standards might be a longer term issue that they could talk about. Somebody brought up the future of interstate commerce. I don't know that I think that might be a little premature at this point. But one topic that continues to come up is consistent product labeling, and that's why I think the structure function discussion might be very useful in a number of ways. But I just wanted to turn it over to the board for some discussion and see if there are any interest areas that you'd like to recommend that I can take to the cannabinoid science work group.
Jim, go to you first. You're going to sit in on these meetings for us.
Yeah, and I was able to sit in on both the first two meetings and the entire part of the first one and the entire second one. And first of all, thank you, Kathy, for leading that group. I thought it was a really good meeting. People are really engaged, but and Kathy already said this, but what I heard was, what do you need? Meaning LCB and the board, what are your priorities? And Kathy identified that. I think that identifying, and Kathy, remind me, this is a short-term group like, what's the duration of this group? Is it 1 year that people are agreed to participate?
It is. It's 1 year, and then it's every other month, but there could be subgroups, sub-meetings in between.
Okay.
So we're not restricted just to that every other month cadence.
Okay. And so, part of the conversation, David and Ollie, was related to, what do we need immediately? What's the long term? And then how does this fit into some desire within the LCB to do more research or be more involved in the research area? And so I think that there are multiple opportunities. One area that I'm super interested in when I look at the bucket of categories, body, DUI, regulation, is I'm super interested in the DUI stuff personally, and I didn't hear as much of that discussed. And I think where it fits into relevant conversation right now is that on the alcohol side, there's a lot of conversation about reducing the blood alcohol concentration from 0.08 to 0.05. But I haven't heard, and maybe there's conversations that I'm not a part of, I haven't heard anything about cannabis and its impact on some of the driving fatalities and things like that. So I'm just curious if that's an area where we might want to look at, since we're doing it on the alcohol side. Other than that, I think that the group was certainly eager to help us once we identify where we want them to lean in.
On the driving, we have had some conversations, but most of those conversations have been how difficult, almost impossible it is today to go down that road because there isn't reliable science or a method for doing it. And when I Google around on this, there's different emerging things that are coming up. But last I've really looked at it, that was what I saw was that. And we had somebody in one of our presentations, I can't remember what it was a while ago, there was some talk about what it would take to be able to get a reliable, because you need a road test, right? You need something that the police can administer at the side of a road. And I don't think that exists in the same form that it does for alcohol.
Agreed, if I may. And the other thing I wanted to point out, that was a discussion we had with our law enforcement panel when we were trying to define what is and is not impairing.
Yeah.
And so I think, that's another thing when we think about cannabinoid science. our agency is already engaged, and actually Dr. Shower reminded me of this, in some really robust discussions about cannabinoid science. In fact, 5 of them that are recorded and up on our webpage.
Right.
And the DUI discussion was one of them, about how challenging that is to move forward in that space.
I think that is something we could use all, and it's part, the conversations around what has happened with traffic accidents and mixed drug use, mixed alcohol drug use for traffic stops and things of that sort. And one thing I wonder about is the sort of more short-term, and like Mark Webster this morning was talking about the THC bill, and that we're there's gonna be a new version with changing some of those definitions, because some of our partner agencies said that it was too narrow and didn't. So just if we played this back, if next year we're getting ready for the session and we have a draft bill like that, could we just send it to this group and say, tell us what you think? Because then you have a group of scientists and other researchers who are able to look at it for that kind of feedback, that maybe we catch some of those things as they go out there, so it's not a long-term research dependent thing. It's just lend us your smarts to,
Yeah, almost in a consultative capacity. Yeah. The other thing, if I may just switch really quickly, the other thing I think that came out, and Member Vollendroff, tell me if you, this was your observation as well, but I think there's a gap between kind of scientific understanding of cannabinoids and how to express that, and then how that same thinking is expressed in statute or regulation. Because there's a tendency to get, on the scientific side, very prescriptive, with chemical compound equations and those sorts of things. And then trying to put that into statute or regulation can become very complicated very quickly. So I think this group could kind of help us close that gap, or at least diminish it some than there already is right now. I think some of the scientific literature I look at, it's really hard to interpret some of those findings, I would say. Yeah.
And the other thing I would look for often, and you and I were talking about this a little bit, but the interplay between our policy operation and research science, it's a kind of a blurred line right now, and you do a lot of that on your own anyhow. But that's, to me, the most valuable service they can provide is helping you in policy get what you need. And either that is emerging things that might come before them, and they could say, hey, I've just read about this new thing, and what do you do, and what do you think about this, which would be super valuable. Or you going to them and saying, we got a petition, or we have this, or we got a board question, and we're going to look at this question of whatever it is, and have that consultative body there. But in more kind of practical, real terms, where it's working in conjunction with you and your team about what you really need in these things. Does that make sense?
It does. And thank you for this conversation. I think it's going to be helpful for them. It's certainly helpful for me to kind of chart the course forward with this, because we have a lot of great people on that group, a lot of great collective knowledge.
Kathy and David, your comments are super helpful. I'm right on track with what I also heard in that meeting. And that was kind of the chicken and the egg conversation. Like, we're trying to make policy decisions, but yet there's no research or science around what we're trying to make. And so there was this conversation about, well, how do we do that? And how can we make policy recommendations when the science or the research isn't there? But the reality, and Jillian, I thought, did a really nice job of helping people understand, the reality is we are in an environment where we are making decisions. We're forced to make decisions with the available data and information that we have. And so part of the gap is identifying where we need more while we're still making policy decisions. So it was a really helpful conversation from that regard.
And the only thing I'd say is I see this group largely separate from the conversation that we've had about our own research capabilities. This would not supplant what we want to do. I can imagine that if we had the research team that we think we should, and hopefully we will, they would be connected with this panel as well. But this panel still has a
Yes.
very valuable service for us. We would not replace them, and they would not replace what
That's right.
we're hoping to do. I can see both playing important roles for us. And,
Yep.
and some of it is just as you're saying on function and structure. Just to your point, definitions don't even exist for so much of the nomenclature that we all have started to use around these things. I don't know how easy it is to do that. It must not be easy, or we would have it.
Right.
But we ran into this last year with our THC bill. What does impairment mean? You know, and so if we could come up, if there's even any progress to be made of agreed upon language around these things that the industry uses and the regulators and the science and the prevention community use, that would be a huge step, right? I mean, just
Agreed, and I think to Member Vollendroff's point, it's bringing, oh, how can I say it? Yes, no thinking into yes and thinking, because that's very much what this is trying to bring scientific thinking, which is not always abstract, into an area of policy that's extremely abstract.
right.
And trying to find the alignment where we can there.
Yeah, putting it to the applied thing. And I know
Yeah.
that sometimes it's hard for scientists to say, okay, yes, we can all agree on that definition, because it depends on so much.
Sure,
But for what we do, we need that.
we
And
do.
if we are in agreement with what the industry's definition is and what prevention and public health's definition, that seems like it would be a huge step. So.
Right.
Yeah.
Right.
All right.
All right, well, thank you very much for that. I've got some things I can take back to the group. And appreciate it.
Great.
Thank
Thank you.
you.
Appreciate it.
Thank you, Kathy.
Thank you.
Okay, so now we are to board member and executive assistant reports. I have one, if I could start, which is just we went live today with the search for the new director. It was posted on our the website of the consulting company that we've hired, which I'll talk about in a second. So here's the updates as now. The LCB has retained Caucus Consulting, which is an Olympia-based recruiting firm to help us with this recruitment for Rick's replacement. They've been talking with us about what that job description looks like and how to describe the agency and things of that sort. And just this morning or last night, they posted that announcement on their website. And first of all, for any job seeker out there, everything's going to be funneled through them. That's the place to go. And that is carrasconsulting.net. It's KARRAS consulting, all one word, .net. And you'll see that there's a button there to view open positions, and you'll see the LCB announcement. And I think they've done a nice job capturing some of the things we've all talked about in that. We don't have well, say we don't have a timeline. The timeline is we need somebody by July 1 when Rick retires. But like, this recruitment is open. I don't think there's a cutoff in. I should look before I say that, but you know, anyhow, my point is, if somebody's interested, they should go and look at it. Also, I would just, anybody who's listening obviously cares about the LCB, so spread the word to somebody who you might know might be interested, or organizations that you know, are in the alcohol or cannabis industry regulation, and just sort of help us spread the word and get it out there. So, and I am looking to see if they did set any kind of. Okay, so they say applications no later than March 15th. So they would like to do that. And you will see it talks about the agency and even what a great state Washington State is, in case there's somebody from outside the state who's interested. So wanted to share that. And I think that's the only update on the search that we have at this point. You guys, any questions or concerns about where we're going so far, Jim or Ollie?
It is a national search, right?
Absolutely.
Okay.
Yep. Yeah, and they have produced plan for advertising. They do both paid advertising and free wherever they're able to get it with different organizations and websites and things of that sort. And I'll make sure that you all see all those details. Also, it'll be on the state careers.wa.gov site, but you won't be able to apply through the state. You'll be directed to Caucus Consulting just to make sure that everybody is seen by the recruiters and they do it. But yeah, it's absolutely national.
That's great. And David and Ollie, I've been really impressed with the involvement of the board in terms of the job description, and hope to be involved. And I'm assuming we will be in the line of questioning that's developed. And, you know, as I've been meeting with folks in the community, I was just down in Rochester meeting with an individual yesterday. I'm asking questions of people like, what are the qualities you're looking for in a director as somebody in the industry? And so just really encouraging people to give us questions, give us things to think about. We've got our own opinions about what we're looking, both as a board, as a organization, and I'm really interested in what the industry is looking for in a director as well. So appreciate the suggested lines of questioning that I'm getting, and would encourage people to let us know what they're looking for in a new director from a lot of different perspectives.
Yeah, in fact, it's a good reminder. So, and not just the industry, but all our stakeholders. And one of the things that we can do now is when you meet somebody like you did yesterday, and they have some insight or ideas, we should send those names to the Caucuses, because they're going to start reaching out to people to get that kind of information, Jim. What are you looking for as a stakeholder? You know, what questions would you ask, or all those sorts of things? And they told me yesterday they're really looking for as broad a list of names. And so we'll be sending them key legislators, obviously people in the governor's office, people in the industry. I'd really want to make sure that prevention and public health are represented there, tribal governments. Anybody who we deal with on a regular basis, we should just come up with the names of people who we think would be helpful, and send it to the Caucuses, and they'll reach out to them as they build this search. Because even though the job description is out there and the recruitment notice, that's just the starting bang, right? And now comes the much harder work. And so the more we can tell them about what the community at large wants, but also what the three of us want. You know, this is our hire, and we need to keep thinking about what are the qualifications, the values, the experience that we specifically want to see in that position to take us to this next, you know, phase of our history. So I've been trying to think about that myself, and Rick obviously is super engaged in this process as well, and helping them understand the industry at large, and will be super helpful, I think, with connecting us with potential national organizations where applicants might be looking as well.
Great. Thank you.
And I have a one-on-one schedule with them this afternoon, so I think they are probably scheduling one-on-one. All of us. Yeah.
Rick, you wanted to say something? Hold on, Rick.
There we go.
Okay, Rick.
Thanks, Justin. No, I appreciate the discussion. I just wanted to add that I want to make sure, I think I sent it to Jim. Ollie, I know we're meeting this afternoon, and I'll make sure you see it, but Kara's put together a recruitment timeline that breaks up into 3 phases. And I want to make sure from the discussion that you're having right now that we've captured that in that timeline. And it gives, obviously, the first phase we're almost at the end of, because the announcement has in fact gone out. So I'll make sure you get a copy of that. I know, Jim, I sent it to you, and David, I know you've been in those discussions with us from the beginning, but appreciate the discussion. Thanks.
Yeah, and the Caucuses are as open as we need them to be. So don't ever hesitate if you have ideas or questions about the search or applicants or anything else. Just ping them, and they'll get back to you on this. I think they'll be really helpful. So Okay, anything else to report today from Ollie or
I
Jim?
have just one quick thing that I didn't want to take Mark's time since it seemed like it was time limited, but I did want to just let you know, and I assuming you guys have access to it, or so in meeting with Rick last week around the legislative session, I didn't have access to the drive in which the weekly reports and the tracking that Mark had put together was available to me. So Destin's been working on that. I don't know if I've actually got access to it yet or not, but just wanted to make sure that you guys had access to it and just let you know that that's I did not up until now, and so it's in process if you haven't had access to it.
Great. I get the reports, but not all. I'm sure Dustin will make sure we can all get into that and do
Yeah.
that. Thanks for that
Yeah.
heads up. Yeah.
That's it.
Okay. Dustin, anything to report today?
Nothing extra today.
Okay. All right, great. Thank you all. Good to see you. And we'll adjourn the board caucus meeting for February 7th, 2023. And we'll see you for EMT is next on our agenda, right? Tomorrow afternoon.
Yep, 1:30.
Okay. 1:30 tomorrow, executive management team. All right. Bye, everybody. Have a good day.